If you break your wrist, you go to the doctors and they give you a cast to help heal the bone. If you have bad eyesight, you go to the eye doctor and they give you glasses or contacts to help your eyesight. So, if you have a mental illness, why not go to a psychiatrist and get the help you need? For anything else, it's no problem to go to the doctors and get medicine or get what you need. The same rules apply for your brain. Mental illnesses are a lot more common than you think. Depression affects 20% of teens by the time they are adults. Depression, anxiety disorders, schizophrenia, and so many more are all serious mental disorders and require professional help. I think the biggest problem with people getting help or reaching out for help is that they are either embarrassed or feel uncomfortable. Throughout this speech, I will talk about a few different mental illnesses and different kinds of treatment options. So many people suffer from mental illnesses and they don't need to be suffering. Anxiety disorders are the most common mental illness. About 40 million adults ages 18 and up are affected by some type of anxiety disorder, and only 37% of those people are treated. Different types of anxiety disorders include panic disorder, social anxiety disorder, different types of phobias, separation anxiety. For any mental illness, there is always the option of going to therapy. Therapy is known for helping people talk through their feelings and give support. It can also give tips on how to cope with or handle your anxiety. There are also different medications that can be prescribed to help reduce symptoms and make each day easier. One kind of medication is SSRIs, which stand for selective serotonin reuptake inhibitors. The way these medications work is that they allow the brain to stop reabsorbing serotonin. Serotonin is a stress hormone which can play a vital role in mood changes. More examples of anxiety medications include Lexapro, Prozac, and Zoloft. Some people are against taking medications for anxiety, but it can really help with people who are struggling. Depression is another very common mental illness. It affects almost 300 million people of all ages worldwide. Suicide is the second leading cause of death from ages 10 to 34. Symptoms of depression include sadness, no pleasure in daily activities, sleep schedule changes, excessive crying, suicidal thoughts, weight gain, or weight loss. Depression is a serious mental illness and requires professional help. I can relate to this mental illness because I struggle with depression. Coming from someone with depression, it is definitely hard to come out and say that you need help. For me, it took my friends and my family to get me professional help. There are so many different resources that can help someone with depression. Therapy is an option and can be a tremendous help. Therapy helps someone with depression open up and talk about what they are feeling and why they feel that way. Medications are also a huge help. Antidepressants are prescribed for people with severe depression and they help lift moods. Another resource for people with severe depression are inpatient and outpatient facilities or psychiatric hospitals. Places like this specialize with mental illnesses, including severe depressive disorder. Schizophrenia is another serious mental illness, and someone with schizophrenia experiences thoughts or experiences that seem out of touch with reality. Someone with this disorder may also experience these symptoms: repetitive movements, delusion or confusion, anger, inappropriate emotions, and speech problems. Treatment options for schizophrenia are a number of things, and usually with this disorder, it takes a combination of things to help a person with schizophrenia. That being said, someone with schizophrenia should go to therapy, take medication, and most of the time should be put in a psychiatric hospital. Bipolar disorder, summed up into 2 words, is mood episodes. Someone with bipolar disorder experiences moods of highs and lows, and their mood can change within a matter of minutes. This mental illness I can also relate to personally because my aunt had bipolar disorder. Seeing someone with bipolar is the saddest thing. It is very important for people with bipolar disorder to take their medicine. I only know this information because my aunt did not take her medicine and she committed suicide. Bipolar disorder needs to be treated and cannot be left untreated. Therapy is always an option for any mental illness, especially bipolar disorder. Another treatment option for bipolar is medications such as anticonvulsants and antipsychotics. Another option is psychiatric hospitals and clinics. Another one is eating disorders. The 2 different kinds of eating disorders I'll talk about is anorexia and bulimia. Someone who is anorexic views themselves as overweight, even if they're severely underweight, and they avoid eating foods in general, but they also avoid eating foods with high calories. Someone with bulimia will purge, which means they'll eat a lot of food in a certain amount of time and then make themselves throw up. Both of these could be life-threatening since the loss of weight so fast and not getting the proper nutrition that your body needs. People with these eating disorders should go to therapy and or take medications. For eating disorders, it is more common for people to go to group therapy and talk to other people with the same disorders as them. Inpatient and outpatient facilities are also very helpful when it comes to eating disorders. Mental health is very important and is something everyone should be aware of, and I just think everyone should always be kind and considerate to everyone else's feelings. With this speech, I hope I can persuade at least one person to go and get help. I hope you're now more educated on mental health and realize how important it is for people to get help. Along with mental health and mental health awareness, you should always be kind to others because you never know what someone else is going through. Throughout this speech, I talked about different mental illnesses and different treatment options, and I really encourage people with mental illnesses to get help, or if you know someone struggling, push them to get help, talk to them and tell them where they can get help. And here's a video to also sum up what I just talked about.
You know that feeling where your thoughts scare you or make life tough? Sometimes it feels like no one else in the world has those thoughts or feelings. No one seems to know how difficult it is to deal with your feelings. And it's not easy to share your deepest secrets. You might think something is wrong with you. Or you might worry what other people think. And all of that makes your thoughts and feelings worse. Our culture has created this environment of shame. Until the 1960s, society sent people away if they had challenges managing their thoughts, emotions, and behaviors. Over time, we learned that we didn't have to be afraid. We learned how to help people get better. We became hopeful. But there are remnants of those images in our culture today, which is why some people still feel uncomfortable talking about it. The stigma has taken new forms too. With more access to more people all the time, it can seem like the world is telling us it's not okay to be anything but perfect. The truth is, everyone has thoughts or feelings that can be hard to deal with. So why do we make it so difficult on ourselves by judging others who could be going through the same challenges we are? What if, instead of seeing labels, we saw people who are struggling and could be there for them so they didn't feel so alone? What if we looked past our fear of mental health and started to talk about it in a constructive way? What if, as a society, we used empowering words and healthy images to help people feel supported? Maybe then, more of us could feel comfortable telling others when we're having a hard time. Maybe more people would get the help they need. And maybe one day we won't have to talk separately about mental health and physical health, but just health. The truth is, each of us has the power to change our culture. Will you join us? Share this video with a kid, your neighbor, a friend, and help us break the stigma of mental health.
There's my source.